Hello friends, in this video we're going to learn about top 5 medical tips. Hopefully these 5 tips will help you stay organized and get a better medical care. Now I've learned these and experienced these things to be very important over the years of my practice, and I truly believe that if these things are organized, it helps us deliver better medical care, and I would think that many docs would also wish that too for their patients. So it's a two-way street. We need to help each other out. Without ado, we're going to start. Welcome to Doc on Mission. My name is Dr. Javaid. I'm an internal medicine physician practicing as a hospitalist. So today's video, top 5 medical tips. Tip number 1, right? You got to see a doctor, and more specifically for an annual exam. Get an annual physical exam. That acts as a key building block. Why? And this is based on my prior experience too. For example, we all heard about that year 2017, and even prior years, there was no airplane crash death in the US based on commercial jetliners. And that's a good news. I could tell you from my personal experience coming from aviation industry, where I was trained to be a FAA certified power plant mechanic. Working on these planes, we were sort of kind of grilled one thing again and again. Inspect the plane, do the prevention. Why? Because in midair, there's no brakes. There's no pit stop. So we have to do everything while the plane is on the ground. So what we did was we did inspections of planes, routine inspections, where we try to pick up small little things, a nick, a crack, even a cracks that naked eye can't see. We would use different techniques trying to pick them out and address them way early in time, because you don't want these things to occur and become big down the line. And these safety measures are the results why flights are so safer now. Now, I wish this was in medicine too. It's not, but this is why an annual physical exam becomes important, because although you're fine, but we'll be able to pick up anything way early and address it. And some of the examples are high blood pressure, high cholesterol, diabetes, any other signs of malignancy, which means cancer. So a lot of these things get picked up early. We can address it much better, right? And I know we're all busy. I'm guilty of it too, but we all need to not procrastinate and really get on it. So that's tip number 1, right? Do not procrastinate, schedule an appointment, pick a date, and every year try to go to your doctor or your healthcare provider during that time. A helpful hint in this case would be your birthday or a new year. And second tip is screening tests. So when you see your physician on your annual exam or in any other visits as well, discuss about screening tests. Again, screening test is a part of preventive care, where you screen for diseases, which I said earlier about high blood pressure, high cholesterol, but we could go into even other diseases such as cancers, where you could do screening for breast cancer, genetic screening for colon cancer. So there are many other diseases as well, which are age appropriate. So talk to your healthcare provider that at your age, what's recommended, what's guideline, and so you can follow those and make sure you get them. Again, they play a vital role in making sure that you're healthy. That leads to us to tip number 3, which is again very important tip and often do get overlooked. It's the medication. Yes, as we age, we're seeing people with tons of medications. There are people who are basically, I tell them, you're eating a meal of medications, 10, 15, 18 tablets. I can't even keep track of it by looking at it, and that's so many. So my recommendation here is talk to your doctors to review your medication every time. Every time you go to your healthcare provider, say, hey, this is my list. What am I taking? Do I need something? Can I take off something? Can I reduce the dose? Can I reduce the days? Discuss. Every time open discussion will bring a lot of ideas to it. Because as you get healthier, the goal will be to taper down on some medications. And I understand some can't go off. Some medications need to be there. This is why the idea is to talk to your provider every time. Because believe me, the more number of doctors you go to, the more medications get added. Every new doc may keep adding medication and may not remove it, thinking someone else started it may be important. So that's why it's a key thing to talk to your primary care physician or provider. And second aspect in medication is to make sure you go through your medication cabinet. Why is that important? Because there's a lot of medication sitting in there that expired. I have patients who end up taking some medications that are 10 years expired, 15 years expired. They would say, oh yeah, I was sitting in the medication cabinet and they took it. And here they're thinking they're taking the medication, but maybe that medication is not effective because the compound have broken down. It's half-life already. So that's what's important, to make sure you clean up the medication cabinet. And third part within this category that's very important again and gets overlooked is to make sure all medications are out of reach of children. And these medications are absolutely very dangerous, and I know pharmacy is trying to create a lot of different ways of skewing caps and other things, but yet just want to make sure don't lay these things out, don't put in a height where children can reach, make sure they're up and they're secure. Next tip, medical records. This one is a big one. I have to say thank God we're going to electronic medical records. Although yes, doctors are hating it because now you're working in front of the screen all day long. You may feel like, hey, what is my doctor not talking to me, and keep looking at the computer screen and plugging in whatever data we're plugging in. Now, there's a lot of bureaucracy behind it, a lot of legislation. We have to do a lot of clicks, a lot of things, a lot of different documents in different ways that were dictated by the government and insurance companies. But let's put that to the side. Overall, in my experience, medical record electronically are superior, far better than the paper chart. Believe me, when I worked on those paper charts, I could not read handwriting and vice versa. Maybe people couldn't read my handwriting. That was the worst way to practice medicine in today's time, because we have electronic medical records, which is far more easier to read and efficient. So why am I telling you this? We use it in the hospital, but now these medical records are becoming advanced, which means you also have access from home. Right? Most of your primary care doctors, most of the hospital EMRs have a portal for patients, so make sure you sign up for it. Same thing, some maybe labs, maybe radiology, they may have their own portal. I'm not sure about those, but I know every medical record from the doctor's offices do, so you sign up for it. Some other part of the world have broken down into different parts where their lab has it, or where the radiology has it, where their doctor has it. But in US, primarily you're dealing with your primary care provider and or hospital. So sign up for that. And the reason it's going to help us is when you're coming to see a doc, or if there's an emergency where you're traveling and you go to a different place, all you got to do is click, click, click. Hey, this is my medical record, review it. And we tend to review it, and it helps us to treat better because we know what's going on. We don't double on the test. We don't guess. We know what happened in the past. Where do we need to go? And it sort of kind of leads the path. Very critical thing in terms of making sure you get a good care. Also make sure that your home medical records are up to date. What I mean by that, make sure you keep a diary to yourself when you go to doctors or healthcare providers or consultants, specialists. Write down what they recommended, what medication they've started, and also what tests they're recommending. And if there are any abnormal tests or major exams that have been done, make sure you write them down. Change of medication, write them down. And when you bring this stuff at home, make sure it's organized in a folder or in a book, and always try to keep it up to date and clean and not messy. Don't just bring everything and drop it in the drawer, right? Then it's hard to shift through. But if it's something nice, and you carry this with you wherever you go, to any time you go to an appointment, and it would help us. And final tip of the day. I don't know how to bring this up, but it's so important. Some people may not like to talk about it. This is personal. This could be, something you don't want to share, but it's important to bring it up and make sure you talk to yourself about it. Make sure you talk to your loved ones about it. Make sure you talk to your primary care about it. Advanced directives. Now, what is advanced directives? All it's saying is basically you, in your today's good state of mind, where you can make decisions, you can understand what's happening, making a decision what to do in terms of your health care when you can't make a decision. And when you talk to yourself what you want, you talk to your family, you talk to your primary care doctor or your healthcare provider, you'll actually understand what's going on better, and hopefully you can dictate. Now, the advanced directive comes in various ways, and remember, I cannot tell you to make what's better, what to make a decision. This decision comes from you because it's your body. You want to make a decision, and also with the assistance of your family and your doctors. And every state may have different policy, every country may have different policy, but the bulk, the pillars remains the same no matter where you go. So number one is healthcare proxy, also known as durable power of attorney or attorney of healthcare. What does that mean? What it means is you're picking somebody and saying, hey, person XYZ, you are going to make decisions on my behalf and I can't make a decision. And this is not just for old people. This is for anybody, because anything can happen at any time. Going into a car crash, falling down, God knows what. So therefore you assign that person and you tell them that, hey, when something happens to me, make sure you make decisions on my behalf. And then as a healthcare provider, we know who to go to, rather than going with 5, 10, 20 different family members, and then there's a whole argument of who do what, or what to do, what not to do. It delays the care as well. At the same time, if you already have healthcare proxy, kudos to you, but make sure it's updated. Make sure that person, your relationships are still there, you still feel comfortable with that person, and stick and update it. Now, second thing that comes in here is living will. Living will is very similar to healthcare proxy, but here you're not exactly picking a person, but you're also dictating, saying, hey, you know what? Do this to me in terms of treatment guideline, and you can sit with your physician and design this thing. And one of the most common thing that I come across is feeding tube. Some people will say, hey, don't put feeding tube in me, and others would say, hey, I need feeding tube. And for those who don't know what feeding tube is, what means a person really can't eat or drink, or they're really not in good state of mind to eat and drink, we tend to put a feeding tube straight into the stomach and then give a tube feed through it. And that's what keeps the person alive, by giving nutrition support. So make sure you work on that living will. And the last one is called DNR, DNI, or do not resuscitate, do not intubate, right? What this means is when the heart stops or person stops breathing, we, especially in the healthcare setting, whether it's a clinic or it's a hospital, we tend to do is automatically resuscitation. Now, resuscitation is a CPR. CPR we all seen on television. Chest compression, right? Trying to restart the heart, shock the heart, trying to restart the heart, and also put a person on a breathing machine if they're not breathing, or when the heart stops, making sure that we could circulate the oxygen. So to reduces the risk of brain death. So now this one is a tough one. Like, what do you want to do with it? May depend on your age, may depend on your medical problems. If there's a terminal problem, what to do. If it's advanced age, maybe 100, I don't know. Some people would prefer not to do anything, saying I lived a good life. Others would say, you know what, do it, give it a shot. Others would say try it once, but don't do it too many times. So there's a variety of things. This is why it's important to sit down with healthcare provider and family members and discuss what's best in your situation. And then remember, you're the one who's going to make the decision. So that ends the tip. So I just wanted to say that this is an educational episode. I want you to basically not make any decision based on this video. However, take this education stuff to your healthcare provider, because this is not an advice. This is more material for you to take it to your physician or your healthcare provider and really discuss and expand on each category, right? Hopefully this helps. If it helps you, please share it, spread the good word. We really need to spread the wisdom. Thank you so much. See you on next episode.
I hope you find this video helpful. Please like, comment, share, and subscribe. Thank you for watching.